Your multiple sclerosis is being treated, and then you come up with a new symptom. Now you're worried. Is it a new activity of MS, or could it be something else? Dr. Robert Shin will describe how he will go about working up this new symptom for you to find out if it is MS or if it might be due to something else like an infection or some other problem that can be addressed in a different way.
Hi, my name is Bob Shin. I'm a neurologist at MedStar Georgetown University Hospital. I specialize in the treatment of multiple sclerosis. When we're talking about MS, a lot of times we talk about multiple sclerosis relapses. So what is a relapse? We use a lot of different terms interchangeably when we're talking about MS. We talk about a relapse, we might use the term exacerbation, attack, or episode. Multiple sclerosis is characterized in most cases with episodes of neurological problems. For example, a patient might have blurred vision in one eye. Hopefully that would gradually get better. Maybe later on some numbness or tingling. Maybe a little bit of weakness or clumsiness. And these episodes occur at different points in time. That really gives us that term, multiple sclerosis. That type of MS that I just described, honestly the most common and we feel the most mild form of MS, we refer to as relapsing multiple sclerosis. Each relapse or episode is a sign of a little bit of inflammation in the brain or spinal cord. Now, when patients have been diagnosed with relapsing MS, we often move that conversation into what are our treatment options for that. There are different types of multiple sclerosis. The most common and the mildest form, as I just described, is what we call relapsing MS, where patients have episodes of neurological problems at different points in time. They may have full or partial recovery in between those episodes or relapses. There are some MS patients who hear that and they don't even know what we're talking about because in their experience, their MS has been gradual worsening over time. Maybe a little bit of clumsiness, a little bit of trouble walking that just gradually got worse over time so that they eventually started to need things like a cane or maybe eventually a walker and maybe eventually a wheelchair. That kind of gradual worsening type of MS we refer to as progressive MS. Honestly, it's a little bit harder to treat, although I am happy to say that there are newer treatment options, some of which are effective for the progressive form of MS. But the most common form of MS is relapsing MS, and so most of my patients have that type of MS, but they may ask, when they're having a new symptom, does it mean that their MS is active? How do they know whether they're having an MS attack or relapse? So I usually rely on two different symptoms, basically, or factors. If a patient calls me and says, I'm having symptoms, I'm worried that I might be having an MS attack, I focus on two things. First of all, is this a new symptom? The reason I focus on that is that it's actually normal for patients with MS to have, let's say they have an attack of some type of relapse where they have a symptom, let's say body numbness. Generally that actually gets better, which is awesome, but it's normal over time for that numbness and tingling to maybe resurface at different points in time. It might resurface when they're ill or very tired. For some patients, actually heat will bring the symptom out. For instance, a hot shower or sitting too long in a sauna might bring the symptom back out. So if it's an old symptom that's resurfacing, I usually try to reassure patients that does not suggest an MS attack or relapse. That does not suggest new damage. In fact, in a way, that's sort of par for the course. The other factor I ask about is how long has it lasted? Because I think you and I, we all can have funny neurological symptoms that I might wake up and my arm is numb. Or maybe for a moment I had some double vision, I had to rub my eyes out. Brief symptoms are not really alarming, but if you were to have a new neurological symptom that lasts for at least 24 to 48 hours, that would be something where I would at least consider the possibility that there's been a new injury, a relapse, an episode of neurological problems. So again, when a patient calls me and is concerned about symptoms, I just focus on those two issues. Is it a new symptom, and has it lasted for at least 24 to 48 straight hours? If that's the case, depending on the situation, I may recommend an MRI scan, because remember, MRI scans give us very detailed, non-invasive pictures that could tell us if there's a new area of inflammation. Or sometimes I may trust my clinical exam and the history and make a diagnosis of an MS relapse on that basis. So once we've identified that a patient might have had an MS attack, we sometimes talk about, well, what are we going to do about that episode? I have to say, not all MS relapses or attacks need to be treated. So for example, if a patient has a very mild, slight numbness in the fingertips or just a purely sensory kind of a symptom, and if it's not bothering them, sometimes we'll let that go because we do know MS relapses typically do get better on their own. On the other hand, if the symptom is very severe or bothersome, or if it affects vision or coordination in a way that would limit them, for instance, at work or at home, then we may talk about trying to speed up that recovery. There are different treatment options. I'm not going to go through each of the different ones, but they are forms of anti-inflammatory medications like steroids, for example. So your healthcare provider can help you if you need to speed up that recovery from that MS relapse. What I would say is in a way even more important in terms of my trying to figure out whether my patient is having an MS attack is that if my MS patient is having a relapse or an attack and is already on treatment, that's going to trigger a question in my mind: can we do better? As I've mentioned elsewhere, we have a lot of different treatment options now that have evolved over the past 20, 25 years of MS, and we keep getting better at treating this disease. If I have a patient who's on a treatment, maybe they've been on a first-generation treatment for a long time, they're tolerating it really well, it's shutting down their MS, I'm really not going to recommend a change. But if a patient's on one of their MS medicines but is actually still having relapses, I'm at least going to ask that question: can we do better? Because again, we have these newer treatment options, and my goal, as I mentioned earlier, is to really shut down this disease. So again, MS symptom, that doesn't always mean it's an MS relapses. Remember, is it a new symptom and has it lasted for more than 24 to 48 hours? Then definitely you're going to want to get that looked at. If it does look like it's an MS relapse, you and your healthcare provider can discuss whether this is something that should be treated or whether you should let it ride. But we do have treatment options to speed up that recovery. But I would say even most importantly, if there is an MS relapse, that's going to trigger that question: can we do better? Is there a treatment option that might be even more effective, again with that goal of really shutting down this disease?